Welcome back. You're listening to Politics Uncensored with me, Zoe Grunewald, without Ali Milani this week, but never fear, it's just us and we'll get through it. An interesting report came out this week, the Mayfield Report, which is absolutely vital reading to understand what exactly is going on with our with health, employment and the economy. It found that 800,000 more people are out of work now due to health conditions than were in 2019. And joining me now to discuss this report and what it means for all of us is Sam Atwell, Policy and Research Manager at the Health Foundation. Sam, thank you so much for joining us today. I'd just love you to start by telling us why it is the case that 800,000 more people are out of work now than in 2019 due to health conditions, costing employers £85 billion a year, and how much of a problem this poses to the UK society and economy.
Hi, Zoe. Well, thank you so much for having me. The absolute number one reason I think we're seeing these pressures is there are simply more people, more working age people who have health problems. So the latest data, we have 8.7 million people aged 16 to 64 who have a work limiting health problem. That's a problem that, prevents them from being able to work or poses challenges for them. That was only 6 million people a decade ago. So we have far more people with health problems. I think the sort of second reason, and this is what sort of Sir Charlie Mayfield's report really gets into, is that our system just isn't very well designed to keep people in work when they have health problems. So there are more people falling out at risk of falling out of work, and a weak system. This is kind of what's driving these pressures. Why is it a problem? Well, I mean, firstly, for individuals, being out of work is often quite bad for you. It's bad for your health. It can cause social isolation. For employers, employers are facing recruitment and retention challenges that we need to address. And for the government, if for fewer people are working, that means there's fewer people paying taxes. It becomes harder to relieve pressures on the NHS, on the welfare system, to pay for pensions for the increasing number of retirees we have. So it's a big problem, I think, that affects all of us in society.
Yeah, it sounds like it's almost kind of a doom loop, right? Where people fall out of the workplace, and as you say, then their tax revenue falls out. It makes it harder to fund those public services that keep people healthy and get people into work. So it is a very, very difficult problem and absolutely key for this government. What sort of recommendations came from this report for government? I mean, it sets out this huge issue, but what exactly can be done?
Well, I think what the report is really doing is setting out a roadmap for employers to lead the charge. And, and at a basic level, this makes sense, right? Because no credible plan for keeping Britain working wouldn't have employers at its absolute centre. So what it's doing, I think, is setting up the principles for what employers should be doing to support health at work from the moment someone's recruited all the way to perhaps whether they're on long-term sickness absence or even about to move on to a different employer. What can employers do to help that person stay in work? What the role for government in this is setting the table. So how can you set the conditions where employers can do these things? And that means looking at lots of different things. It means thinking, well, is our sick pay system, our statutory sick pay system up to scratch? Are the fit notes that people receive when they go to the doctor, is that system working? Does our welfare system support active recovery and rehabilitation? And, not to give away any spoilers, the answer to those questions is no, not at the moment. So there's certainly work that needs to be done.
We'll talk about the employment and what employers can do in a second. But I'm interested to talk about some of these proposals, as you say, setting the table from government, because obviously welfare has been a huge flashpoint politically for this government. They want to reform the welfare system and they want to get people back to work. Do you think the things that the government have been proposing, i.e. changes to PIP, for example, trying to get people back into the workplace by not penalising them for seeking work when they're on welfare benefits, is that all broadly in line with the sort of recommendations in this report? Or is there something is there a trick the government's been missing?
Well, I think the approach the government has taken on welfare has been quite a mixed picture. So you're absolutely right to say there was this big controversial debates over the summer because the government tried to make it more difficult to claim PIP, which is the benefit that disabled people receive to help them with the cost of living. And it did successfully, in its eyes, cut the universal credit health element for new claimants. So that's people who are out of work that's the benefit that they receive if they can't work because of a health condition. I think so. Those things I don't think necessarily do support the sort of vision of enabling people to thrive in work. But there are other elements of the government's welfare programme that are perhaps more aligned. So, for example, they have committed to not reassessing people who are on long-term out of work benefits if they try work and it doesn't work out. So that should help reduce some of the fears that people feel about trying work. They've also got a very interesting proposal for what they call an unemployment insurance benefit, which is to provide much better financial support to people when they first fall out of work quicker. And we think at the Health Foundation, that's an opportunity to really get some practical support that helps people back into the workplace earlier than's the case in the current system.
And you kind of spoke about the role employers have here. In this picture, and this was obviously the focus of the report, and you spoke about how falling out of work makes people sick, and that is undoubtedly true. But of course, if you are working in an insecure job with poor pay, with a bullying manager or with inflexible working requests, and if you're managing childcare, all these things that can actually make you sick. As we know, it can cause stress, it can cause anxiety, all these kind of things. So clearly there is a role for employment in itself to improving people's health. And this is something that the government has taken on board in its employment rights legislation, which is trying to push through at the minute. But this has received some pushback from business. So the chief executive of the British Retail Consortium, Helen Dickinson, said the government's goals and its policies, such as the Workers' Rights Bill, were at odds with one another. She said encouraging employers to invest in workforce health and provide flexibility, they risk making it more difficult. Do you agree? And is there a balance we can strike between improving people's working conditions and their health, but at the same time supporting businesses to actually be able to do that as well? Because we know there have been concerns over things like the national insurance rises and the costs that place on business. Now there's fears that the Workers' Rights Bill will put more regulation on business, cost businesses more. What I'm asking is, how do we get that balance right?
Yeah. Well, I mean, when you speak to business owners and, in particular small businesses, it is absolutely clear that many are facing quite significant cost pressures. And it's important to be realistic that businesses, like the rest of us in life, face trade-offs. If you spend money on one thing, it's harder to spend money on another thing. But that being said, I'm not sure I agree with the characterization that the vision set out in Charlie Mayfield's report and, what the government's doing with the Employment Rights Bill, for example, are completely at odds with one another. For starters, I mean, many of the measures in the Employment Rights Bill around increasing a right to request flexible working, for example, or enabling sick pay from the first day of sickness, or a right to a contract which reflects the actual number of hours you work. Those are all things which are the foundations of what a good job, a healthy job would look like. So I don't think there are odds there. The second thing that I would say is that, businesses are already facing these pressures around health. They're already spending absolutely billions on trying to solve these problems in the workplace. When you speak to business owners, one of the many things that they're grappling with is, well, how do I spend this money most effectively? There's a proliferation of workplace well-being apps or, different types of provider that how can I navigate that and make sure I'm getting the best bang for my buck? I think the vision that the Mayfield report is trying to set out is thinking, well, over time, can we build the evidence to help businesses spend the money they're already spending much more effectively? And that would be better for them, but importantly, it'd be better for the workers themselves.
That's really interesting. And yes, I think you make some really excellent points there about, I guess, how this doesn't have to be expensive for businesses, right? So one of the things disability campaign groups have been saying when there was the row over cutting PIP and helping disabled people get back into work was that actually a lot of businesses could do quite simple things to make just to help encourage disabled people back into the workplace. And some of them don't cost anything. It can be things like flexible working requests, or just understanding that some people might need slightly different tools or might need a slightly different approach when going about their job. Is part of this actually just an issue of guidance, having clearer guidance for businesses about how to deal with sick and disabled employees? Is it that actually it's quite difficult for small businesses to know where to start with some of this stuff?
Yeah, I absolutely think that is the case. There is a lot of guidance out there, a lot of really good guidance. It's sometimes quite hard to navigate. And one of the challenges, I think, is that, well, you might be some general guidance out there, what a good job looks like, what flexible working looks like. But what if my workforce are all nurses and we need to provide 24-hour round the clock care? What if I, run a factory that needs 24-hour shift work, etc.? So in my specific context, how do I apply this guidance? That's the challenge that a lot of businesses face. So what we've called for at the Health Foundation, which I think is aligned with what Charlie Mayfield is calling for in his report, is can we sort of start developing that into sort of sector specific guidance that will help employers adopt best practice rather than and help them navigate to the things that are most likely to help them. I think also, secondly, there's also a space, and Charlie Mayfield's report also calls for this. He calls it workplace health provision, but what we call it is specialist caseworker support. So when someone is sick and in work, can you get this sort of specialist advice to that person to help them manage their condition, understand what it's like to live with that condition, but also to their employer so you can have sort of tailored early guidance on what adjustments might need to be in place to keep that person in work. That's a real gap in the UK system, but it's the cornerstone of places, like the Netherlands or Denmark that do a better job than we do.
Um, a lot of rhetoric around this issue is about getting people back to work, and I think we've spoken about some of the kind of reasonable adjustments that could be made there. But there's also obviously a huge role here for prevention, and that's obviously what your work focuses a lot on. Talk to us a little bit about what prevention looks like practically. What could a preventative approach to improving workplace health look like?
Well, I think to be honest, we've already started talking about it in some senses because when you start thinking about a healthy job, you are thinking about the absolute basics. Do people have good line management? Do people have the opportunity to work flexibly if needed? Do people have access to things like occupational health or vocational rehabilitation support if they do get sick? So those are some of the basics that I think any employer can start thinking about and putting in place. I think, as I say, then when people are starting to get sick, a preventative approach is can you get support to that person before they've been off sick for 3 months? Quite often what happens is that when people go off sick and employers are quite nervous, they don't quite know how to manage that conversation, distance grows between the employee and the employer, and that's not productive. That means that actually over time, people are more likely to drift away and further from the workplace. So what we need is a way to get people that type of support, that specialist support, which, assesses what they need, triages them to the right help, advises the employer, get that to them before they go on to long-term sickness absence.
Okay, and I'm going to ask you a question now, which is it's kind of my own personal bugbear. Do you think, because when you ask people when they're kind of most stressed in their day, they often say it's when they were with their manager. What do you think about compulsory management training?
Well, I mean, I think it's absolutely right, and it's borne out in the evidence that people's managers have a big impact on their overall well-being. And, and it's not just, I think, managers. It reflects a wider thing about workplace culture. Does your organization prioritize the types of things that are supportive of better health in the workplace? Things like, taking time off if you need it, etc. Because those are the things which affect how managers behave. On compulsory management training, I think there is evidence that training can be effective at improving managers. I guess the question is who delivers it,
Yes.
who's trusted, and how do you sort of get that to the right people?
And of course, one management approach might not work, as we were just saying. Every person is different. Every person has different needs. So one management approach might not work for everyone. But I do think something needs to be done about bad managers, and I can say that because I'm freelance. So I'm not. Pointing at anyone specifically. I just want to ask you, in our final minute left, Wes Streeting, the Health Secretary, has said a change in government guidance reflects a shift in attitude to treating employment as being just as vital to health as diet and exercise. Do you agree?
I would absolutely agree with that. And I think, just very quickly, there's 1.7 million people in this country that have a health condition that was caused or made worse by their work. So as a proof point of Wes Streeting's point, I think that's absolutely clear. At the Health Foundation, we talk about the building blocks of health. Work is a building block of health, just like diet or exercise is. So if you can get more people into good jobs, you'll be building a healthier nation.
Sam Atwell, thank you so much for joining us. That was Sam Atwell, Policy and Research Manager at the Health Foundation.